The purpose of this training DVD is to reinforce the principles and application of effective aseptic non-touch technique within all settings, such as clinical and other care settings, including patients' homes. It is for all healthcare professionals, irrespective of the healthcare environment. Every year, 9% of patients suffer from healthcare-acquired infections, and around 5,000 people die as a result. Aside from this high mortality rate, other people are suffering unnecessarily, with avoidable hospital admissions and prolonged stays. Unfortunately, some of these infections are transmitted to patients through contact with healthcare staff. Media coverage of MRSA and C. difficile outbreaks mean that public confidence in healthcare has been undermined. As a result, the prevention of the spread of infection is now a major government initiative. Healthcare professionals can play their part by practicing good aseptic non-touch technique, or ANTT. Aseptic non-touch technique is a best practice procedure that's been endorsed by the Department of Health and the Infection Prevention Society. It tackles the risk of transmitting microorganisms from one area of a patient to another vulnerable area, and it helps prevent the spread of infection from healthcare workers to patients, either directly or through contaminated surfaces. The word sterile means free from microorganisms. Due to the natural multitude of organisms in the atmosphere, it's not possible to achieve a true sterile technique, even when wearing sterile gloves. Sterile techniques can only be achieved in controlled environments, such as a laminar airflow cabinet or a specially equipped theatre. The commonly used term, sterile technique, is therefore inaccurate, as practitioners are not actually achieving their stated objective. Healthcare-associated infections occur because vulnerable sites, for example, invasive devices such as IV access, cannulae and urinary catheters, and skin breaches such as wounds, become contaminated by a sufficient number of virulent pathogenic organisms. Therefore, a technique that prevents such a level of pathogenic organisms from contaminating vulnerable areas and ultimately entering the patient's bloodstream is a safe technique. Such a technique is most accurately termed an aseptic technique, as the word asepsis means freedom from infection or infectious or pathogenic material. Therefore, unlike sterile techniques, aseptic techniques can be achieved in any healthcare setting, including hospitals, community settings, and patients' homes. Asepsis is as clean as it gets. An important aspect of aseptic non-touch technique is the identification of key parts so that healthcare staff recognize them and don't touch them. If touching is unavoidable, then sterile gloves must be worn to minimize the risk of contamination. Recognizing which are the key parts is essential to good ANTT practice. ANTT requires the healthcare worker to stop and think during procedures, and not just follow ritualistic practice. ANTT includes effective hand cleansing procedures, how to create an aseptic field on which you can lay out dressings or equipment and make sure it's used properly, and how to identify key parts such as damaged skin and wounds, dressing materials, and the parts of equipment most likely to introduce infection if contaminated. Imagine you're a patient. Consider the potential harm from these practices. We all know that hand washing is an important part of infection prevention, but it's surprisingly easy to do this incorrectly. This nurse is wearing a watch and rings. She's been so quick that she hasn't washed all parts of her hands properly, so they're not sanitized. And by opening the bin with her hand, she's risked further contamination. This nurse has given her hands a quick rub with alcohol gel, but she hasn't cleaned them thoroughly enough. Also, her gloves may not be clean. There are 3 problems here. The contents of the dressing pack are being touched by a bare hand. The key part, the sterile dressing, is being handled. And thirdly, the healthcare worker is not bare below the elbows. It's important to remember that it's not safe to touch key parts, even when you're wearing gloves. So how should these nurses have cleaned their hands and made sure they didn't contaminate key parts? The ANTT procedure recommends the following. Healthcare workers should be bare below the elbows, have short, clean, natural nails, and not wear wristwatches or jewellery. Ideally, you should wash your hands in warm water using liquid soap. Rub your palms together several times, including spaces between the fingers, lacing them together. Wash the backs of your hands, making sure you clean between the fingers. Use a rotational method to clean your thumbs in turn. Fingertips should be cleaned in the palms of the opposing hands. Then clean the wrists and rinse thoroughly to remove soap. Hands should be dried carefully using paper towels. Pat rather than rub to reduce the risk of damage to the skin. Ensure that the finger webs are dry. Use more than one towel if necessary. Be careful not to contaminate your clean hands when turning off taps. If sensor or elbow-operated taps are not available, then use a paper towel to turn off the taps instead. And remember to dispose of paper towels carefully.
Hi Mrs. Jones, how are you doing?
Hello David.
If you follow ANTT in the clinical setting, you'll minimise the risk of spreading infection to your more vulnerable patients.
Right then, I'll just wash my hands and pull your kids around. I'll be back in a sec, okay?
Before beginning a procedure, always make sure you wash your hands thoroughly, following the correct technique. If you're using a trolley, it should be cleaned before assembling your equipment. Once the aseptic field has been created, apply alcohol gel. The technique for using alcohol gel is similar to the hand washing technique. Rub gel into the palms, between the finger spaces, covering the backs of both hands, finger webs, and each thumb in turn. Ensure all surfaces of the hands, fingernails and wrists are well covered in gel. Allow it to dry. Choosing the right glove is very important. If no key parts, and that includes damaged skin, are going to be touched, then unsterile gloves taken straight from the storage box are fine. Open the pack, being careful to touch the outer corners only. Use the plastic waste bag contained in the pack to arrange the contents on your aseptic field. Ensure that everything you'll need to dress the wound is arranged on the aseptic area before removing the patient's used dressing. Once the dressing has been removed and safely deposited in the waste, along with your apron and non-sterile gloves, hands must be decontaminated before putting your gloves on. The choice of gloves will depend on the procedure. The last stage of ANTT is very important. It's imperative that you dispose of all waste. Take off your apron and gloves. And then clean your hands before touching anything else and before helping the patient to leave.
There we go. Do you want to lower yourself?
Seeing patients in a domestic situation presents much more of a challenge for the healthcare worker. But if you follow the ANTT guidelines, you'll minimise the risk to your patients. Before you start, make sure that you ask for any household pets to be taken out of the room to maintain cleanliness and to ensure your safety. Apply the same hand-washing procedure at the patient's home as you would in a clinical environment, but using the items available to you. For example, use a liquid soap for hand washing and turn off the taps using kitchen paper. You may not always have access to a clean basin, warm water, soap and paper towels. In these circumstances, alcohol hand gel can be used. In a patient's home, a dressing trolley will not be available, so it's important to identify a suitable surface for your aseptic area and arrange everything you're going to need for the procedure. This is a stop and think moment. Glove choice depends on whether you need to touch anything that is or might contaminate a key part, including the surface of the wound. If you'll be touching the wound or the primary dressing where it comes into contact with a skin breach, then use sterile gloves. As within the clinical setting, open the pack carefully, touching the outer corners only. Using the plastic waste bag contained in the pack, arrange the contents on your aseptic field. Ensure that everything you'll need to dress the wound is arranged on the aseptic area before removing the patient's dressing. Once you have removed the used dressing, dispose of it into the waste bag, together with your apron and gloves. Alcohol gel must be used on the hands prior to putting on sterile gloves. Follow the same procedure as described in the clinical setting. Ensure that sterile dressings are picked up by the corners only, and when applying to the wound, that they're held by the side away from the wound surface. Make sure that you place all of the waste, including your apron and gloves, into the rubbish bag. This should then be disposed of following your Trust's waste policy. The guidelines shown here should assist you in adopting the aseptic non-touch technique. Remember the three main elements: maintain effective hand hygiene, create appropriate aseptic fields, identify and protect key parts. A successful ANTT program includes training, assessment and compliance auditing as part of an ongoing cycle of clinical audit with the support and involvement of all levels of staff. As the Department of Health says, this is the board-to-ward approach of infection prevention and control, which is everyone's business.